Hello and welcome to the Nutrition Diva podcast. I'm your host, Monica Reinagel, and this week's episode was prompted by Josh, who sent in this question.
Hi, Monica. I'm a longtime follower of Nutrition Diva, and I was hoping you could give me your take on AMLA, also called Indian Gooseberry, supplements to reduce cholesterol. I have naturally high cholesterol despite exercising regularly and eating a relatively healthful, high fiber and low saturated fat diet.
Amla, or Indian gooseberry, is a small green fruit, approximately an inch in diameter, that grows on small trees throughout India and Asia. Like most berries, it's rich in vitamin C and other antioxidants. But compared to other berries, it is relatively high in fiber. Now, the amla gooseberry is edible as a fruit, but it's pretty sour and astringent. And when it is served as a fruit, it's usually cooked in a sugar syrup. However, the dried powdered fruit is also a staple of the ancient Hindu system of Ayurvedic medicine. It's thought to be good for the skin, the eyes, the heart, and to have general anti-aging properties. It's also used to treat everything from fever to bleeding disorders, diabetes, sore throats, hair loss, even low sex drive. Like most traditional medicine systems, Ayurvedic medicine was developed and refined over thousands of years using observation and experience. And that's exactly where science begins. In fact, the Sanskrit word Ayurveda literally translates to the science of life. However, Ayurvedic medicine was developed and codified long before the emergence of the modern scientific method, which involves systematic testing of hypotheses under conditions that attempt to eliminate as many variables as possible. Some of the biggest variables, of course, are the beliefs and the expectations of both the experimenters and the subjects of the experiment. So ancient Ayurvedic practitioners didn't have the benefit of double-blind, placebo-controlled trials. Now, of course, we do. As modern investigators have put various traditional remedies to the test, certain ancient beliefs about how various herbs and foods work in the body have been disproven, but many of them have been validated. One of the traditional uses of amla is to treat blood sugar disorders, or what we now refer to as diabetes. And controlled trials have confirmed that powdered amla does, in fact, reduce both early morning and post-meal blood sugar levels. And that's in people both with and without type 2 diabetes. But what was even more notable was its beneficial effects on cholesterol levels. A subsequent trial compared the effects of powdered Indian gooseberry to a popular cholesterol-lowering drug in 60 people with high cholesterol. And after 6 weeks, all of the subjects had a significant reduction in their total and their LDL cholesterol and a significant increase in HDL cholesterol. The effects of the amla on total and LDL cholesterol were comparable to the cholesterol medication, even a little bit better. However, the cholesterol-lowering drug was more effective in raising HDL and lowering total triglycerides. On the other hand, those who were taking the amla also experienced a significant reduction in their blood pressure, and that's a benefit that those taking the cholesterol-lowering medication did not enjoy. In their conclusions, the researchers stopped short of suggesting that amla could or should replace cholesterol-lowering medications. After all, we have decades of data on millions of patients taking cholesterol-lowering drugs versus one 6-week trial of amla. But they do suggest that adding amla to a cholesterol-lowering drug regimen might allow patients to lower the dosage of the drug and might actually add some additional benefits. Clearly, that's something that doctors would want to evaluate with their patients on a case-by-case basis. Practitioners of Western medicine often place a very high value on the scientific method as the gold standard for making treatment decisions. However, I should point out that that gold standard also has its weaknesses, notably a somewhat reductionist tendency. In our attempts to isolate variables and reduce bias, we sometimes lose track of the fact that individual factors are always functioning within a much larger context. And one of the things that these traditional approaches to medicine offer is a much more holistic view of both the patient and the conditions that affect the patient. And finally, I just want to say a quick word to any of you who may have what Josh refers to as naturally high cholesterol levels. Diet and exercise, or the lack thereof, do have an effect on the amount of cholesterol circulating in your blood. But genetics also plays a role here, and I'd hate for anyone with a genetic predisposition to feel that they've failed because they were unable to control their cholesterol levels through diet and exercise alone. Sometimes cholesterol levels remain stubbornly high, even when people are very diligent about their diet and their lifestyle. And in those cases, cholesterol medications can be extremely helpful. But if you're in that situation, it might be worth an experiment, in collaboration with your doctor, of course, to see whether a combination of amla and your medication might produce better results or allow you to lower your dosage of the pharmaceutical. In the show notes for today's episode, which you can find in your podcast app or at nutrition-diva.simplecast.com, I've included links to a couple of the key studies if you'd like to share those with your doctor. If you have a nutrition question for me, you can send me an email. I'm at nutrition@quickanddirtytips.com, or you can call the Nutrition Diva listener line at 443-961-6206 and leave me a voicemail. Also, just a quick announcement that we're soon going to be opening enrollment in our year-long Way Less program, where we help people create the mindset, the habits, and the lifestyle that allow them to maintain a healthy weight without dieting. And over the next few weeks, we're going to be hosting a series of events to share more about our approach and just to help folks decide whether it's a good fit for them. To stay in the loop, go to wayless.life and just click on the button to get on our mailing list for announcements. And that link is also in today's show notes. The Nutrition Diva podcast is a quick and dirty tips show. It's audio engineered by Nathan Sems with script editing by Adam Cecil. Our team at Macmillan also includes Morgan Christensen, Davina Tomlin, and our intern, Brendan Pika. Thanks for listening, and remember to eat something good for me.